All right, let's talk about the basics of breast reductions. My name is Dr. Nadya Clarke. I'm a board certified plastic surgeon in Bethesda, Maryland, and we're going to talk about the most common procedure I get asked about daily, breast reductions. We're going to do this in two parts because it got a little long. So what is a breast reduction? This is a surgery that's going to remove mass and volume from the breast. It's also going to remove skin to tighten the breast, and it's going to lift the breast back up onto the breast footprint. So with every reduction, you do get a lift. Why would a woman want to get a breast reduction? There's various reasons why somebody would want a breast reduction, but women with heavy breasts have symptoms that are very bothersome to them. So this could range from neck strain and neck pain, shoulder pain, upper back pain, shoulder grooving from your bra strap, rashes underneath the breast that can open up and need to be treated with antibiotics. It can be emotionally distressing to always have people staring at your chest. It can be difficult to find clothing that fits appropriately. Your buttons might be stretching and popping. And people say that they feel sexualized all of the time, no matter what they're wearing, whether it's a high cut or low cut shirt, their breasts are always center stage. It can be difficult to exercise with heavy breasts in the way and to play with your children. And it can also be expensive. Very large breasted women have to special order these custom bras that are $100+ just for a basic bra. So all of these things together make it very bothersome to have very large breasts. So what are the steps to getting a breast reduction? First, you have to really research the topic and determine if this is something you really want to move forward with, whether your breasts are a burden to you to where you would want to go through surgery, and emotionally, are you ready for it? A lot of people have had very large breasts since they were in middle school, and so it's something they're very used to. So it can be an emotional roller coaster to not have breasts that are that large after surgery. It's something people get very attached to, even though it is problematic for them. So that's something to consider. And then do a little bit of research on what size you're comfortable being after surgery. So don't get stuck on any particular cup size because bra sizes differ vastly from store to store. So instead of thinking about a cup size, think about how much smaller you want to be. Do you want to be 50% smaller, 30% smaller? And if there is a popular celebrity person who has the same build as you, that you think you would want your chest to look similar to them, that is a nice reference to have to give me an idea of where your mind is at and what you're thinking about. But just keep in mind, you are not that person. You are going to look like you after surgery, just with a smaller lifted chest. I cannot guarantee you that you're going to look like anybody else after a breast reduction. So how do we actually go about getting the surgery scheduled and moving forward with it? So there's two different ways you can get a breast reduction. You can do a cosmetic route, which I would give you a quote and you would move forward with the surgery that way, like any other cosmetic surgery, or you're trying to go through insurance. Obviously, if you're going through insurance, the process is a bit longer. There's more hoops to jump through to getting that approval process. Some insurances will approve a breast reduction if they deem it medically necessary, and some will not approve it no matter what, regardless. The steps to getting a breast reduction approved are as follows. Some insurances will require that you have to go through first steps before you can even submit a pre-authorization. So they might say you need to go to physical therapy, you need to have seen a chiropractor, you need to have tried NSAIDs and different pain medications to help you with your symptoms and have failed those before they will accept a pre-authorization for surgery. Let's talk about the pre-authorization process in the next video.